This is Neil Schneider for MTBS-TV at SVVR 2017. To my immediate right is John Lockhart. John is the head of advanced therapies at Penumbra. Welcome to the program, John.
Thank you.
So tell us, what does Penumbra do?
We are a medical device manufacturer in Alameda, California. We make devices primarily to treat stroke minimally invasively and other diseases in the body.
Okay, so for those unfamiliar, and that includes me, how is stroke usually treated?
So if a patient has a stroke and they are detected at the right time and they get to the right hospital, they can get into a surgical suite where doctors do minimally invasive surgery with a catheter, a small thin tube. They go in through the femoral artery in the groin. They can navigate that all the way into the brain, turn on an aspiration pump, and perform what's called aspiration thrombectomy, suck that clot right out of the brain, kind of like a miniature vacuum cleaner.
It sounds very involved. Is it a specialization? Is it something just any physician could do, or you have to be like the top expert in that?
It is a very, very highly specialized procedure done by a number of different specialties, but after years and years of post-medical school training.
So under normal circumstances, when it comes to training for a procedure like this, how would physicians normally do that?
So physicians spend 2 years after their specialty, like say radiology or neurosurgery. They spend 2 additional years training to navigate catheters into the brain. So it is a very highly skilled, highly apprenticed kind of procedure. What we've developed here is a fairly simplistic, for the first time, simulation of that experience. It's not really at the level that it could train a physician to do that yet. They still do that over 2 years of real medical intensive training in a hospital, but it's to simulate the environment. Maybe for those who've never had exposure to it, researchers, nurses, clinicians that know this kind of stroke procedure happens but aren't going to be able to be in a surgical operating room to see how it works.
Now, I know this is very experimental. Can you describe the experience?
So yeah, this is an initial prototype we developed in partnership with Sixth Sense. It's a collaborative, two-way, interactive conversation between a physician and a trainer about how to do this procedure, the sequence of steps, the products involved, the urgency of getting a clot out in the presence of an acute stroke. And those two people could be anywhere in the world with an experience like this, rather than coming to a training center on a cadaver model or an animal model or just a benchtop physical model. It's all done in virtual reality, so 2 users could be in different parts of the world and still communicate, collaborate, and work with each other.
Now, I know this is very preliminary. Are there any obvious benefits that come to mind by doing something like this in virtual reality in medicine?
Well, we're looking at what the benefits are. This was just a proof of concept we did with Sixth Sense, but there's obvious sort of e-learning and distance education. Doctors in other parts of the world that may not have access to experts, say in the United States or Europe, who are very skilled in this procedure, could then work with those experts and train with just a headset on either side inside this immersive collaborative environment. You could imagine with a more sophisticated piece of software, you could simulate patient anatomy, doctors could practice doing it in tricky situations. There's all of that kind of simulation and education potential for it, maybe.
Now, this is a pretty specialized procedure. Do you see a similar potential in other medical procedures as far as education is concerned?
Yeah, absolutely. I mean, again, this is a highly specific experience that was tailored to minimally invasive surgery for stroke. And there are other companies looking at endoscopy, surgical simulators, I've read about companies overlaying MRI data on top of an actual patient and doing pre-surgical planning. So I think the field of VR for healthcare is quite broad, and lots of potential in the future.
Now, I keep underscoring that it's preliminary, because I know it's something you threw as maybe a proof of concept. Do you have a vision of this perhaps reducing the time it takes to educate physicians on something like this, or is it an additional tool? Any vision on this? I
think it's an additional tool. I don't see the world of apprenticed medical training in real life in hospitals over that 2-year fellowship I mentioned going away anytime soon. Not at all, and that's not really our intention to replace anything like that. This is a way to explain how devices work together, work in concert with each other, to give others who aren't physicians a chance to experience an environment they wouldn't otherwise experience, and potentially in the future with a lot more refinement, allow physicians to practice, who are already fellowship trained in this, to practice tricky situations that may be patient specific to a case coming up.
Okay, very good. Have you had a response on this yet? I mean, have you been showing it around? What have people been saying?
We debuted this originally at the International Stroke Conference in Houston about a month ago with a lot of neurologists and interventionalists who do this procedure in real life to a great response. We also had a lot of people come through to try it who, again, were researchers, scientists, critical care nurses who don't work in an operating environment. We're thrilled to see what really goes on firsthand in the sterile operating theater for patients that they care for otherwise. And we've been at the GDC, the Game Developers Conference, at this meeting talking to the broader VR community about the potential for healthcare in VR.
All right, good stuff. Well, thank you so much for joining us. Very exciting stuff.
You're welcome. Thank you.
This is Neil Schneider for MTBS-TV at SVVR 2017. Thank you for watching.